that possibly today we'll have our local Frederick data available. And so when we look at the state level COVID data, we have seen a dramatic increase in the case rate. But what matters most is what the hospital system is experiencing. And that we have had that continuous data for the last 2 weeks to see it go up and up. And as this slide shows, and as the county executive slide had shown, so we see that the numbers of persons in the hospital system are approaching or at the level really of last year, at the peak hospitalization throughout this whole experience. Next slide, please. Frederick Health Hospital has started to post on their website some metrics, and as was mentioned already, looking at the persons who are in the hospital being treated for COVID, the overwhelming majority are persons who are not fully vaccinated. And then they've also broken it down. I've heard in the report last week that they provided related to the ICU folks at the time, where they were reporting that none of them had been vaccinated, of the persons in the intensive care unit at that time. So it underscores the importance of the protective measures. One, the protective measures because we have limited bed capacity. We have limited staffing capacity and bed capacity. And for people who experience a situation, a medical emergency, perhaps completely unrelated to COVID, that if they need an intensive care unit level bed, we all want the bed to be available, whether it's for us, our friends, or our family. So that's why it's important for the whole community to do what they can to try to reduce the rate of spread, the risk of spread, and the rate of spread of the virus. Next slide, please. One more back, please. Oh, another one back. Yeah, so last year, if I were to show you the chart from last year for the cases and outbreaks in the congregate living facilities, so that's the nursing homes and the assisted living facilities and the detention centers, or at least for the assisted living facilities and the nursing homes, you would have seen so many more cases, so many more outbreaks. That's not the situation this year. They have high vaccination rates and also the boosted rates, as well as other protective measures. Now, the protective measures that are in place are, more relaxed than they were last year, but yet their protection persists. So it's a much better situation for persons who are residents and staff in the congregate living facilities this year compared to last year, where we have very few cases. Now, in contrast, the next slide, please, is about the experience of school associated outbreaks. This isn't all the cases. These are just actual ones where it's been listed as an outbreak, and that was of December 15th. And so if you were actually, when you look at tomorrow's data, you will see it's many more when tomorrow's data gets refreshed on this weekly report. So very different situation this year compared to last year, underscoring the importance of all of us doing what we can to try to reduce the risk of spread and the rate of spread. Next slide, please. So we do have great vaccination rates. That's part of what has helped Frederick County, I believe, to be able to avoid the really high rates of infection that our neighbors to the west, to the north, and to the west in other states, what they had been experiencing. I think our relatively high vaccination rate has helped to protect us. But it's, as I've talked before, each of these layers, protective layers, are not 100% effective layers. So vaccination, when we look at our total population that's been vaccinated, fully vaccinated in Frederick County, we're at 67%. Now, not everybody's age eligible, but we still have a ways to go in terms of vaccination and immune system protection. Next slide, please. So we are making progress. So then one of the things that has happened multiple times during this pandemic is that there are changes. So the virus itself changes. The RNA viruses, it's very common that they mutate. And so now we are looking at the Omicron variant. We're still waiting for really good information and good information about the experience here in the United States with the 3 major vaccines, but really with the Pfizer and Moderna vaccine, what the experience is here in the United States, as well as for persons who have not been vaccinated but have prior infection. Because early reports coming out are that the effectiveness from natural immunity from persons who were previously infected, and it's been more than 6 months, the early information is that people will not be as well protected. And also when we look at persons whose vaccination was more than 6 months prior, they also will not have as good of protection from the early data. But when they get a booster dose, it looks like they will have much, much improved and restored immunity against severe illness and death. But again, we're still waiting for the data to have really much better information in the United States. The Delta variant is still really the predominant variant. It's anticipated, though, that Omicron, from the research projections, that it will become the predominant one in perhaps a week. Do the treatments work? So we are still, until there's enough experience with persons who have the Omicron variant, we won't know which treatments will continue to be as effective as they are now for preventing severe illness. But those are specifically, I'm thinking about the monoclonal antibody therapy. So there's still a lot to learn about Omicron. Its transmissibility, it seems like it does spread more easily. Some very, very early reports are that maybe it doesn't cause as severe of illness. But if we look at something that spreads more quickly, so more people are being infected, and even if it's a lower percent of severe illness, we still might have a greater number of individuals who have severe illness at one time. So I wouldn't say we are out of the woods. We are not out of the woods yet. Next slide. When we look at the variant, so there's continual research underway, including in Maryland, even though the data hasn't been available. Maryland has been subtyping the variants. Now there's a lot of laboratory work that needs to be done, and it takes a couple weeks. So that's why there's that delay since Omicron's been here, a delay in being able to have a real good idea of what percent of current infections are attributed to the Omicron variant, and that's because there's a delay from the time the specimen is collected to the time that they've completed the subtyping. So people are continuing to ask, so what is the benefit of vaccination? And again, so we do have information from the Delta variant because it's been with us for a while. The Omicron, we're still waiting to see what that's like. But when we look at the research from, and what you see here is from the CDC, comparing individuals who have been vaccinated with Pfizer or Moderna compared to persons who are not vaccinated, we see that persons who have not been vaccinated are 3 times more likely to become infected and hospitalized, 2 times more likely, and then death 7 times more likely if you're unvaccinated. Next slide, please. So, that real world data. So there's, when I talk about research, there's research that goes on in the laboratory, and then there's research in the real world with real people. rather than looking at, how do the cells in a laboratory petri dish work. And so when we look at the effectiveness of vaccination, and especially in adults over 65, if the nursing home data wasn't impressive enough this year, looking at no deaths attributed to COVID compared to last year, what we do see in the research is that persons who are 65 and older, that vaccination, reduces severe COVID, and that there's a 94% reduction in the risk of being hospitalized by persons who are 65 and over, and 14, and that's if they're fully vaccinated, so 2 weeks or more after their second dose. Next slide, please. So, study of hospitalized patients with symptoms. So, persons who are hospitalized, they have symptoms, hospitalized. This is still with the Delta variant, not so sure yet how it's going to be with the Omicron. But unvaccinated persons who had a previous infection were 5 times more likely to have a positive COVID test compared to vaccinated people. So again, just underscoring the importance of vaccination, and especially if you look at the combination of, I know that there are a lot of folks who have had prior infection and they're considering whether they should get a dose of the vaccine. And so the research where people have been had a natural infection and then they did get a vaccine, that they had even better protection over what they had with just the natural immunity alone. So get vaccinated is the message. Next slide, please. So there are questions about booster doses. So if you remember way back when, persons who have an immune system that doesn't work so well, or that their response to the vaccine might not be as strong as a more typical person with a typically functioning immune system, those persons can get a third dose. And then for other folks whose immune systems, presumably, as best as everybody knows, that they're working okay, then there are the booster doses. So it's recommended now for everybody, if it's been more than 6 months after Pfizer and Moderna, it's recommended to get a booster dose. And if you've had the Johnson & Johnson, Janssen product, 2 months after that single dose, it's recommended that you get a vaccine. And people are able to mix and match. Now, for persons who are under age 16, the booster doses, we don't have the recommendation for them yet, but are waiting for additional guidance. Next slide, please. So when we look at the COVID vaccine for persons who are 5 to 11 years old in Frederick County, there are appointments available at many schools coming up. So while these are the scheduled second dose locations, if persons come for a first dose, we'd be happy to provide a first dose for 5 to 11-year-olds at those clinics. And then they can get their second dose at one of our other locations. But we're glad that FCPS was interested and made their space available for us to offer vaccine. And the way it's been going the last couple weeks is that we have had more appointments available than what that school community or feeder pattern has wanted. So we've been able to open up appointments beyond those individual school communities. Next slide, please. Also, so flu, I know we haven't talked too much about flu. Flu is circulating in the U.S. now compared to last year where it was virtually non-existent. So people want to know, can I get the vaccines at the same time, flu and COVID? Yep, you can do that. And early on, when people were getting the COVID vaccine, then as a precaution, we're asking for people to wait 14 days before they got something like the flu shot, or a flu shot last year. But this year, it isn't necessary to do that. That was an early precaution. One also to make it a little bit easier for people to be able to differentiate whether they're having the common side effects from either of those vaccines, which is like an influenza-like illness or a COVID-like illness with the muscle aches, the fever, the headache. But now that we've got enough experience with the vaccines, and we have more testing available, then it's less critical to have them spaced apart. Next slide. I do want to make sure that people are aware that there is monoclonal antibody treatment available. So Frederick Health and other hospitals in Maryland offer it. There's one home health agency, maybe another one, and a pharmacy in Maryland that are offering it. The state is looking to increase the providers offering monoclonal antibody treatment, and there will be a new one that will be available soon in Maryland, well, and actually throughout the United States, for persons who have experienced organ transplant, solid or blood related transplant, and they'll be able to talk to their healthcare provider about that. So that's our recommendation for people to talk to their healthcare provider. And my almost final slide is the reminder that we have multiple layers of protection. Some of those are ones that we can personally do ourselves, some which are shared responsibilities. And so it begins with, if you're not feeling well, please I would say stay away from others. I mean, it's what we say normally during the cold and flu season. If you're not feeling well, please, share your love, don't share the virus. And so that holds true for coronavirus too. And especially when we're seeing the hospitalization situation that we're experiencing now. So other personal things that we can do. So besides, if you are symptomatic, if you have had a high-risk exposure to someone who tested positive, either confirmed or suspected to have COVID, then quarantine. Take protective measures that you can. There's also vaccination. It's an individual thing that you can do. And then our shared responsibilities. I do move into the quarantine for that as well, but part of that is it's an individual thing that someone needs to do. And testing is an important part. But as the county executive had mentioned, there's a lot of interest in testing, both from persons who are symptomatic, persons who have had exposures, and then people who just want to know before they're going to be around family members. So the at-home testing supplies are in limited quantities, at least the free ones available through the state, and then from the pharmacies, they've been out. So if you don't have testing available, then it makes all those other protective layers even more important. So face covering, physical distancing, indoors, well, if the weather were nicer, outdoors would be better than indoors. The ventilation in the room that you're in, the duration of time that you're there, the face coverings. Did I mention face coverings? Face coverings. All play a role in trying to reduce the risk of spread. Each layer is imperfect, but when combined, hopefully that will be sufficient to help reduce the risk of spread and the rate of spread of the SARS-CoV-2 virus in Frederick County. Next slide. So we do want people to enjoy the holidays as safe as can be. And so if you take in mind the recommendations for face coverings, physical distancing, if you're not feeling well, please try to avoid being around others. Get vaccinated, if you can, get tested, and thank you.
All right, thank you, Dr. Brookmyer. And again, I do want to stress to people that it is important that you get vaccinated, that you get boosted, and that you wear a mask in all indoor public places, and that you stay safe around others. If you do test positive and you have mild symptoms, it's still important to remember that you need to isolate for 10 days so you don't spread it to other people in your family or coworkers who may have a worse reaction than you may have had. So just even if you feel like you've recovered, you still need to continue to isolate. So now I want to switch gears a little bit. This is related. It's a little bit better news. Certainly throughout the pandemic, which is ongoing, Frederick County government has worked to make life better for the people who live here. We've stood up high-volume vaccine clinics, and we've taken vaccine out to the community, and the health department continues to do that. We've delivered meals to our most vulnerable seniors. And we even had, and people forget this, some innovation among our staff who developed a decontamination unit to extend the life of N95 masks when our supplies were short. I will say that's another thing that has been, we're in a different place this year, is, when this started, we did not have enough PPE for our healthcare workers. And we couldn't buy it. And today we do have adequate PPE, and hopefully that will continue. And throughout the pandemic, we provided grants to our small businesses, to our farmers, to our daycare providers, to try to help support our economy and keep it strong. So today we have a once-in-a-lifetime opportunity for the county and our community to build back better and stronger than before the COVID-19 pandemic with smart use of our federal funding, which we have been provided through the Federal American Rescue Plan Act. So Frederick County has been allocated $50.4 million through the Federal American Rescue Plan Act, which we fondly refer to as ARPA because we like to have a shorter name. And we've received half of that funding to date, and we expect the other half to be allocated to us in the spring of next year. So we are seizing the opportunity to use these funds to provide generational investments to lay a foundation for a strong and equitable recovery and some meaningful and lasting change in our community. We want to lift children and their families. We want to make sure our businesses and our economy thrives, and we want to make sure that we have life is even better than before the pandemic. So that might seem like a strange thing to talk about today, but I do want to announce some of our ARPA money allocations. So our goal is to allocate this money smartly and wisely. And when we learned about ARPA funding, we initially began internal discussions to think about how to best use these funds. And then we reached out to our long-term community partners, many of our human service nonprofit agencies and others, to try to brainstorm and develop a framework for meaningful change. This led us to an initial list of proposed projects, which was really a starting point. And I've always been a strong proponent of engaging the public in local government because we know the best ideas often come from the people. So in August, we conducted a survey to identify what the public thought would make the biggest difference to people and businesses as they recovered and renewed. And close to 600 people participated in the survey, and we received thousands of written comments. They provided information about the financial and health impacts of COVID on their households and gave recommendations about how to best use ARPA funds. While some households have experienced few negative financial impacts from the pandemic, others have experienced loss of income, lack of in-person schooling and childcare. Childcare continues to be an issue, and difficulty paying rent or mortgage, food, or transportation costs. Many households also experience health challenges, including mental health, substance misuse, illness, or death from COVID. So in the survey, we asked where the county should invest these federal funds. Mental health, business assistance, and broadband each received top support, with 76% of the respondents saying those should be the priorities. Other priorities areas with high levels of support including help to seniors, housing stability, health disparities, child care, and arts and entertainment, and those ranged from 69 to 74% of respondents. The survey also collected thousands of written comments about services and programs that people in our community needed to recover. After we compiled the survey results, I hosted 3 roundtable discussions this fall. We invited certain stakeholders and experts to participate in these, and we also engaged the public. The roundtables I thought were just really incredibly positive. One focused on human services, one on business and the economy, and the third on health. And we had great discussions. So I really want to encourage people to watch any of these roundtable discussions. I know I left excited and energized about the possibilities. And you can find them on the county's website, along with a lot of other information at frederickcountymd.gov/ARPA, which is again, the American Rescue Plan Act, or ARPA. The webpage includes a list of all the initiatives that have been suggested, the community survey results, presentations our staff has made to the county council, as well as information on how the federal government will allow these funds to be spent. Because like all funds coming from the federal government, they come with a long list of requirements, which limit some of the potential choices that we have. For instance, counties are not permitted to use this money to provide a tax cut. So today I want to share with you how Frederick County has used these funds to date and announce some new investments that are coming out of the first tranche of funding. Approximately $21.5 million has been allocated or committed to projects. Now this work is ongoing. It's a work in progress. It's that type of process, and we expect that new ideas will arise as the months move forward. And there will be future announcements of as a review committee makes additional recommendations to me. Now in the future, I'm just going to announce the new announcements, but today I wanted to kind of go over where we've been and the new things we're announcing today. So we've had extensive outreach, and based on that, we're targeting the use of these funds to 7 priorities or pillars that are integral to our recovery. So these include health disparities, children and families, economic recovery, mental health, seniors, and transportation. Now you'll note that transportation is the foundation of a lot of these. It's connected to pretty much every priority or pillar, and it's important to the outcomes of all of them. So we heard about the need for reliable transportation options in each of our 3 roundtable discussions, so it really is an overarching issue. Health and health disparities ensure a continued robust response to protect public health from the impacts of COVID-19. And we are trying to identify and address systemic health disparities, which are key to our community moving forward in advancing equity. One of my key priorities among these is to strengthen children and families by providing resources and support to improve family stability, to reduce adverse childhood experiences, which we call ACEs, and to ensure success in school. And personally, I really am most excited about our opportunity to improve child health and welfare, to stabilize families, and what that means for securing long-term success and a bright future for our county. We're certainly focused on economic recovery. It's important because we know our economy is also a foundation for our community. This priority demonstrates support for business and agriculture through grants, outreach, and workforce training. Another priority is addressing mental health. The demand for mental health services has certainly increased as a result of the pandemic, and our goal is to strengthen and expand our behavioral health response in our community to meet this need. This includes crisis response efforts, including our 24/7 mobile crisis unit, and looking forward to implementing a crisis stabilization center, which would complete our continuum of care. And last but not least is seniors. We have a growing population of seniors. Seniors were certainly impacted by the pandemic in lots of ways, including isolation. And this priority demonstrates our commitment to ensure resources and support for the seniors in our community so they continue to live safe, healthy, and productive lives. Now, we've received a lot of requests and ideas for a share of the federal Frederick County's American Rescue Plan allocation, and we anticipate additional requests since we are still in the pandemic and our response and recovery is an ongoing process. So, we're still in the pandemic, so when we talk about recovering from it, we're recovering from the initial impacts, and then we'll continue to work on recovering from what still sits in front of us. To ensure that the funds we distribute are spent appropriately, we established an internal review committee, which carefully can review each one of these ideas and requests, and they're looking to make sure they fit into these 7 priorities or pillars that I've identified and that meet the strict guidelines of the federal government. As always, we strive to be fiscally responsible and accountable. The review committee includes the county's chief financial officer, the deputy chief administrative officer, the deputy director of finance, the supervisor of accounting, the director of operations for the Division of Citizen Services, our grants contract administrator in procurement and contracting. And because we want to prioritize and address issues of equity, and it is actually a federal requirement of the ARPA money, which emphasizes equity, our chief equity inclusion officer is also on the review panel. This group meets each week, and ultimately they present their recommendations to me for final approval. The county's also partnered with an outside audit firm, Clifton Larson Allen LLP, to oversee the use of funds and to ensure that we comply with federal tracking and performance reporting requirements. So I do want to say we always want to have an open and transparent process. We're always fiscally responsible. We always account for every dollar we spend because it is public money. And this is something I think in Frederick County we've done really well with all the outreach and with all of the systems we've put in place. So the programs and services I'm going to announce today have been carefully reviewed and will be carefully monitored. So we've had about 16 projects that have been approved to date, with funds either committed or allocated. Some of these have been publicly presented and discussed with the County Council. And today I'm going to share what those are so that you know where we've been, and I'm also going to share some of the new announcements. So let's begin with the priority or pillar of economic recovery. So we previously announced funding of about $810,000 to Visit Frederick, which is our tourism council. The tourism industry has especially been hard hit during the pandemic when travel was limited and actually wasn't permitted. Only essential travel was permitted for some time. Visit Frederick's budget relies on hotel tax revenues, which dropped substantially in 2020. Hotel taxes account for 2/3 of their revenues. So the Tourism Council supports many of our small businesses through grants, advertising, and promotions. So before COVID, tourism generated more than $1 million every day in our economy. It was certainly important. And so this request clearly fits within the economic recovery pillar. And, by helping Visit Frederick, we help our small businesses promote our history, outdoor recreation, our craft beverage makers, our museums, and a lot more. So another top priority under economic recovery grants supports the county's efforts to bring broadband to unserved and underserved areas within the county and to position ourselves to take advantage of significant state and federal dollars that are being made available for broadband. In today's economy, we know that broadband is critical and it's essential for everyday life and for work. We're committing $2 million to expand broadband access and to roll out some initiatives to enhance security of our IT system, which I think we see is real important after you see what happens with the Maryland Department of Health. Now, some of these dollars are going to add staff so that we have people to take advantage of the state and federal grant opportunities and to manage those projects. And I'm pleased to say that county staff is currently getting ready to apply for a second rural broadband grant. So we need to seize that opportunity and we need to have people to do that. And I got to tell you, each week I hear about broadband from people who really are in rural areas or underserved areas or in areas where it's unreliable. So there's a lot of work to be done there. We have several projects that have been approved to support our seniors. Now, previously announced, we announced funding for renovations and upgrades at Bell Court Senior Apartments in Woodsboro. This is a county-owned and managed 28-unit community. $360,000 of ARPA funding will be used to upgrade some major components that are in need of repair and renovation. We've also previously announced $2.5 million from our initial allotment to go to replace lost revenues at Citizens Care and Rehabilitation Center and Montague Assisted Living Facilities, which again are county facilities. And we'll commit another $2.5 million out of the second tranche. Now, these facilities, like all nursing homes, experienced reduced census during the early days of the pandemic and have had all kinds of requirements so that they've had to drastically change how they provide services. A lot of that's had cost associated with it, and that's going to continue in our Congregate facilities moving forward. It's important to note that Citizens in Montague have been self-sustaining. They've had a self-sustaining operation prior to the pandemic, and we've supported assisted living to some of our most vulnerable seniors without cost to our general fund. It's a very successful financial structure, and it does help people. And that is our expectation of how we'll operate these nursing homes moving into the future. Now, today I'm going to announce some new funding awards to support our seniors. First is $300,000 for Advocates for the Aging to purchase various devices and equipment for seniors to retrofit their homes so people can age in place for as long as possible. Examples could include ramps, grab bars, electric lifting chairs, benches to transfer in and out of a bathtub, and special shoes for people with diabetes. Another new allocation is $300,000 towards keeping seniors, veterans, and disabled homeowners in their homes through the nonprofit Rebuilding Together. Rebuilding Together makes home repairs for low-income homeowners so they can remain in their homes. So I want to note that these announcements really, we're not creating new parts of government. We're really supporting our human service nonprofit agencies that already do this work. So it's a great partnership. Another new announcement is to support a project that aligns with two priorities, both seniors and health. In collaboration with Advocates for the Aging, Frederick Health Hospital is interested in launching a program to provide social and medical services to frail seniors in our community. The program is known as PACE, PACE stands for Program for All-Inclusive Care of the Elderly. $125,000 will be used to conduct a feasibility study for the initiative, as well as engage a consulting team to support an application to the state for a state-sponsored PACE program to happen in Frederick. Now, PACE currently operates one location. It's operated by Johns Hopkins, and there's a desire to expand this to add 3 additional locations, and we want one of those locations to be here in Frederick. It is a competitive application. So the PACE program really supports the frail elderly. And it does, I'll tell you a little bit about it. Care teams would provide day health care, medications, medical equipment, nursing care, rehabilitation, and social work services. So it's really a program that's all-inclusive care of the elderly with a focus on the frail elderly. So this $125,000 prepares us for that competitive application. So stay tuned for more on that. Now, in terms of, obviously, we're going to continue to protect public health, and we also want to improve public health. Those are key priorities. So projects focused on health and health disparities include $300,000 for maternal health disparity study. Dr. Brookmyer presented this to the County Council a couple weeks ago. And this is a work to improve outcomes for Black mothers and their infants in Frederick County, where we know there's a large disparity. And this program will engage a grassroots group of women to lead the community and to let us know, and they'll help identify the challenges and the needs. We want to address long-standing disparities in health outcomes for Black women and their infants. We certainly want to reduce infant mortality. Another project presented to the County Council was a program called Family Connects. And this is a program I'm really excited about. This is a program that came out of Duke University. It has 10 years of data. It's data-driven. It's proven to have positive outcomes for children and families, including reducing adverse childhood experiences and helping children have long-term success in school. It's one of the potential largest investments we'll make out of ARPA funding, and it's really exciting and from my standpoint. So it starts with a nurse home visiting program. So we have approximately 2,800 babies born in Frederick County each year. So through Family Connects, a nurse will visit with the home of newborns and their families to check in on mom and baby. They'll do a wellness check. They'll help families navigate feeding and sleeping schedules and connect families with any needed resources, whether it's more follow-up care for the mom or emotional support or even necessities like food and housing. Then the program follows up with these families on an ongoing basis for those who need and want additional support. So when families are supported, families are strengthened. And when families are strengthened, new babies get a good start in life, and these families are successful. So again, I'm very excited. It's hard to describe this in a few sentences, but it is one of these programs that has potential to make life better for Frederick County's next generation. We will allocate $8 million to support this program over a 4-year period, with Frederick Health Hospital taking the lead and building its capacity to support Family Connects ongoing. So eventually the goal is to have the program funded through the hospital's reimbursement and payer networks. So Family Connects aligns with a lot of my priorities, a lot of these pillars that are identified: health disparities, children, and families. Now today I'm also going to announce additional funding to support children and families through a program that we've already had in place, which has been a very successful community collaboration. That's Feeding Frederick. Feeding Frederick connects families and people who are food insecure to free food distribution sites across the county. We do have an internet active map that was launched during the pandemic, so people could find the nearest food and distribution site closest to where they live. You can put your address in, and it will identify where you can get food and what day and what time. This is a collaboration between Frederick County government, the Community Foundation, the Osherman Foundation, and many community partners. So we're going to allocate $44,600 to continue the Feeding Frederick public awareness campaign. So we're providing food. There's lots of food available for people, but often the people who need it don't know where to get it. So this is really about public awareness and making sure that people know where they can get the resources they need. Now, the next project is also a really great community collaboration. The Religious Coalition for Emergency Human Needs is preparing to open their emergency family shelter on Hayward Road on the north end of the city of Frederick. It's expected to open in February of 2022. I've had a tour. It's a lovely renovated project. They've raised a lot of money from the community for it. And this will shelter and house women and children who are facing housing insecurity, including homelessness. Currently, families stay at host churches and move from one church to another each week. It's really a challenge for those women and children, mostly women and children. So $265,000 of the county's ARPA allotment will be used to fit out the shelter, to put furniture and beds, appliances, and supplies into the shelter. I'm very proud to be able to support this community effort to provide our first family emergency shelter in Frederick County, so families can be stabilized and get back on their feet. Another important part of healthy living is our mental health. Mental health issues can arise in many forms: stress, substance misuse, and behavioral issues. Throughout the pandemic, many people have experienced extreme stress because of loss of income, daycare, and sadly, the loss of their loved ones. Grief is a powerful emotion. One way to address grief is to provide an outlet and a place to focus these feelings. So last summer, we asked people to submit ideas for a memorial to help our community deal with their grief. And we requested suggestions for a memorial garden where residents can reflect on those who fell ill or died as a result of COVID. And fortunately, that number is growing. We also want to honor essential workers who continue to support us despite increased risks to their own health and safety, and the fact that they have grown weary after almost 2 years of taking care of people who are sick in our community. So we are setting aside about $250,000 to design, build, and install a COVID memorial. This memorial will be constructed at a location in Utica Park. It will include a tree-lined walkway, benches, and a stone centerpiece to allow reflection and contemplation. This project is being designed now, and it should be completed hopefully sometime next summer. Now, transportation was a big thing that we heard about through all of our roundtables. So today I'm going to announce some new funding to support 3 projects in the transportation arena. We know transportation can be a barrier to accessing healthcare, nutrition, jobs, and education. And again, we heard about this underlying every other topic that we talked about. So to improve public transit, Frederick County will invest $600,000 to update transit services software and hardware. This includes software that provides real-time tracking information, as well as software that provides information to riders on board our buses. We need to be able to offer both written and spoken information so riders of all abilities are informed. We're also going to invest $100,000 to redesign our bus network and integrate our Transit Plus services. So this funding will allow the county to optimize bus stop locations, identify opportunities to better serve growing areas of the county, to create and track updated performance metrics, and engage the community to meet riders' needs, and to reconfigure bus schedules. So it really is about optimizing our services to meet the demand. We'll also be able to streamline Transit Plus, our paratransit service, which is in huge demand for seniors and people with disabilities to get to medical appointments. And the last project is to improve transit's bus stops. $500,000 will be invested for improvements to bus shelters and transfer facilities. These improvements include installing concrete boarding pads to improve safety as passengers get on and off buses, and they'll also engage our community partners to enhance pedestrian safety near our key bus stops. For example, we may need to extend and add curb extensions. We'll also launch an Adopt a Stop program with local businesses to improve visibility of transit and to engage new partners. The plan calls for installing shelters at new locations, enhancing transfer facilities like the depot on Carroll Street in Frederick, where most of our routes intersect. Now, all of these projects that I outlined today are not the only projects that will be funded through our American Rescue Plan Act allotment. There's much more in the queue and a lot of discussion. It is an ongoing process and a work in progress. So you'll expect to hear more from me after the first of the year. I really want to thank the committee who works hard to review these ideas and applications, and certainly we expect to hear new ideas and applications as we move forward. We're working on the details for a community recovery grant program to support some nonprofits that may not have the capacity to meet strict federal reporting requirements. And I will say the Community Foundation, as an outcome of one of our roundtables, offered to have training to help people to do that reporting work. So stay tuned for more information on this grant program and other new initiatives that we will announce in the new year. So with that, I want to close, and I want to take an opportunity to wish everyone a Merry Christmas, a blessed Kwanzaa, and a Happy New Year. I want to encourage you to be safe, to be healthy, to take all those health precautions as we gather. We want to keep our community healthy and safe. We want to reduce deaths in our community. We want to protect our hospital from becoming overwhelmed so people can get the care they need. So please do your part. Please get vaccinated. Please get boosted. Please wear a mask indoors at all public places. Use testing if you're going to have some kind of family gathering. And make sure your holiday season is safe and filled with joy and love. So happy holidays to all of you. And with that, we're adjourned for today. And I want to thank Dr. Brookmyer for all she does. We're adjourned.